So, good afternoon and welcome to On Point. I'm so happy to have Kimberly Claytor here today, and Kimberly is the president of the NMFT. So, Kimberly, could you tell us a little bit about the NMFT and what that stands for and who you represent?
Sure. NMFT stands for Newport Mesa Federation of Teachers, and we are a local teachers union. We are an American Federation of Teachers union, and we represent all of the non-management certificated staff in Newport Mesa Unified School District. That includes teachers, counselors, psychologists, speech and language therapists, librarians, nurses. I'm sure there's some I'm missing, but
how many?
There are about 1,400 members in our bargaining unit.
Okay, good. So you're quoted as saying several weeks ago regarding negotiations, "We will not stand for a fair weather friend relationship with the district. They expect us to be partners in the bad times and servants in the good times." Can you tell us a little bit about? Yeah, I know. Can you tell us a little bit about that? Right.
Yeah. So over the last several years, obviously we've gone through some hard economic times throughout the country and throughout the world, for that matter. And our through negotiations, we have taken cuts in our salary in the form of increased costs of benefits. So we've increased our out-of-pocket from our paycheck, and we've also increased the out-of-pocket that we pay for at the doctor's office, at the pharmacy, whenever we utilize the benefits. So, and then we haven't had any raises either. So we are a district that has been able to continue the same number of instructional days. We have not had furlough days, and I know that our families and our bargaining unit members appreciate, obviously, the work, but I think our community really appreciates that we have continued with full instructional days, and frankly, we're a district that didn't need to cut.
There seems to be, and this is really mostly about benefits, but there seems to be some hostility between the two unions, the CSEA and the NMFT. So your thoughts about that, and can you explain that?
Well, it seems that there is a lot of hostility right now, and unfortunately, this is exactly what management really, it works to the benefit of management, right? So, it's kind of a classic divide and conquer tactic, especially in negotiations. So if you can get one bargaining unit divided against another bargaining unit, so different employee groups is what I'm really talking about. In this case, it seems that the district has been able to divide all employee groups against those that are in our group, the non-management certificated staff that we represent. The tactic of divide and conquer definitely works for management, and it seems to be unfortunate that it's from my perspective, from what I see, from my opinion, it seems as if management has been able to, I would say, shove this tentative agreement down the throats of classified staff and get them to agree to a substandard agreement with the district, and kept them from actually fighting for what it is that they actually deserve. And I think that all of the employees of Newport Mesa deserve to have full benefits covered by the district. We're a district that, we have extraordinary employees. We provide extraordinary service to our community. and there's no reason that we should not enjoy the extraordinary benefits.
The what is it, the sticking point? I mean, it's basically, as I understand it, it is PPO HMO with a slice of Kaiser as opposed to the POS. So what I know that the union has that the NMFT has a definite feeling about that. So can you explain that just briefly and what the difference would be?
Well, I want to really state that the main sticking point is the process by which the district is engaging in this negotiation in negotiations. We don't. So by law, you can present the proposals that are out there to the public after they're presented at the table, and so Fred Navarro has taken that, and it seems to me that's what's happening is they present at the negotiations table for the sole purpose of being able to publish what they've presented at the table, and they're not really negotiating, so their tactics are unfair. I've already mentioned the tactics of divide and conquer the different employee groups, and pitting one employee group against another, or in this case pitting administrators, classified, all the other employee groups against the certificated non-management. So all of these tactics are they're just unfair and disrespectful. They're undignified. And I think that our members are worthy of a fair process.
Can you explain just briefly the PO, because some people won't know what is the POS and what is a PPO and an HMO and the slice of Kaiser?
Okay.
Okay.
So currently, every employee in Newport Mesa that signs up for medical benefits is on the same plan. So this district enjoys the power of numbers, the economy of scale. So we enjoy the benefit of everyone being on the same plan. And that same plan, the POS plan, allows for everyone to have to participate in HMO. So everyone has an HMO doctor. We can go to HMO for our routine checkups. We can go to our HMO for everything if we want to. But in the case of, like we heard at one of our school board meetings recently, about a few of our bargaining unit members who went to their HMO doctors, they went the HMO path, and they got to a path in the HMO, what was covered under the HMO, where one of the doctors, we had one of our bargaining unit members that took her son to an oncologist who said that that there was going to be needed to have brain surgery, and when the member asked the doctor, well, would you do this for your child if this is what your child had? And the doctor said, no, I wouldn't, but this is the path of the HMO path here. So in order for us to sometimes go beyond the path of the HMO plan, we can do that by going out of network or using the PPO part. We can go outside of the HMO plan with our POS plan as needed. If you're on a HMO only plan, you don't have the option of going outside of the HMO plan, and really the plan. What are the steps that are needed before you get to the next step? You have to go through all these steps before they'll approve the next step. That would be the HMO plan. Kaiser is you'd be with Kaiser doctors, Kaiser Hospital, Kaiser facilities, and it's another HMO. It's just a different.
What is a slice of Kaiser?
Slice of Kaiser means that some members. It just means that a portion of all of the employees can opt to go to Kaiser.
But not too many.
No, the quotes are based on assumptions about how many will go to Kaiser, and I believe it was up to 15%. The assumption was that, the quote that we got from Anthem was based on an assumption of, I believe, up to 15% going to Kaiser. Now, I do want to emphasize, though, that we have had these options in the past in Newport Mesa, and people may not remember that we have had options of going HMO, PPO in the past, and lots of districts have done this, and what they end up with is a death spiral, what we know in our benefits committee as a death spiral. So when you divide it, when you have options between HMO and PPO, those who utilize lots of health services typically take the PPO portion, and those who are healthy and just go to the doctor once a year, and typically young people have young families that they're all healthy, they'll stick with the HMO. And then what happens, the cost of the PPO plan gets higher and higher and higher, and we call that the death spiral, because at some point you never can afford to keep that PPO plan, because only the sickest of the members are using that plan. And the benefit of us all being on the same plan is you spread the risk out over the entire pool, and therefore it does not get too expensive. And that is really a fundamental value.
You said the POS plan, right? You
the POS plan, right? Yes. That we're all on the same plan, which is the POS plan. That we all have the same plan allows us to maintain the cost of that plan, the overall cost of that plan, at a reasonable rate, because we don't have all of one group, and I don't mean employee group, I mean a group of people that utilize the services because maybe they're sick and they need them, and they should use them.
So last night, and I don't have a lot of time to ask you this question, but last night David Johnson said that if they didn't have their way and they didn't have the PPO HMO with a Kaiser slice, they would then go off on their own. And we only have maybe a minute to answer that.
Okay. Well, there are some technical aspects to that they will have to address, because you can't, I don't know how another employee group just leaves the district. I don't know if he's talking about starting their own plan. If that's the case, they're going to have to figure out how the district's going to contribute to that, completely separate. There's a lot of technical questions that have to be asked. Okay. And one thing I do want to say is that we have a benefits committee that has worked really well for many, many, many years. And this year it looks as though it might be destroyed. And I don't blame that on David and his comments.
Okay, on that sad note, I'm going to have to say goodbye.
Okay.
Thank you so much for coming in.
Thanks.